Okay, so how would you determine if a COVID 19 patient requires to go to the ICU?
We would, when does a COVID-19 patient need to go into the ICU? It really depends on a few factors. Number one, the breathing. Is he able to breathe with room air, or does he need a bit of supplemental oxygen? Or have we given him 100% oxygen and he's still not coping? In such a situation, we'll need the machines to help him to breathe, and that's where he goes into ICU. Some of the patients ends up with very low blood pressure. When that happens, we would give medications to support and lift up the blood pressure, and this will help the person. Remember, a lot of the people who develops complications are the older age group individuals. They may end up with a heart attack, they may end up with a stroke, they may end up with unexpected complications where you need to have extra care, extra monitoring, and that's where they go into intensive care unit. Now, so far, majority of the patients are recovering well despite having to go into intensive care unit. Again, it is the very old, the elderly with comorbidities that makes it difficult for them to come out of it. Now, the for those people who have been reading around the topic, you realize that the critical care units or the ICU beds are the most important precious commodity there is in the whole country. If you saturate all the ICU beds, then a person who's truly sick will not have the chance to come in, make use of facilities, and with that, death rates goes up. It is imperative thus that we keep our ICU beds relatively empty so they can cope with a sudden upsurge in numbers, and survival, the outcomes will be much better for the country, for the individual with COVID 19.
Okay. So I have a baby who's 7 months old. Should I be worried?
In theoretically, we would always be concerned about infections in children, young children. But we're a little bit surprised with COVID 19. The young children, the very young, seems to do reasonably well. They do much better than someone of my age. So I wouldn't be particularly worried. But nonetheless, I'll be watchful over the child and make sure that the child doesn't have a significant fever, the child is eating well, and is playing well. Of course, check the poop and the pee regularly. If that happens, well and fine, I think your child will be okay. In general, the rule of the thumb is this: children do much better with COVID 19 than the older parents or the grandparents. Youth, it has a protection.